We all know that how important it is to have a nice, natural looking and confident smile. So replacing even one single tooth with implant is not just like a drilling and put the implant in. There are so many factors we need to address. Sometimes replacing even one single implant is really challenging because of the patient oral health or the situation that we are dealing with. We want to make sure patient has a nice pink gum around the implant, make sure the gum line in the implant area and other teeth, it looks natural and kind of like an even blend, not like up and down. In terms of the bulk or thickness of the tissue and covering the implant is really important, because if that thickness doesn't exist, then the implant shadow, like a metal shadow showing when patients smile. So these are some of the factors that we could easily, with the initial examination, make a model. We can have everything, kind of have a build up in the lab to make sure what are the limitation factors. There are some patients that they come to our practice, they are missing one tooth, but the other teeth have some other restorations that overall patient already doesn't have in a good smile and natural smile. So we need to plan it in advance. So at the end of the day, when patient get their implant, when they get a future crown on that implant, they will live like happy. If we give the patient enough information in advance, they know that there is a sequence in order to, get to the goal that have a natural and beautiful smile. If you're using denture for so many years, or you have missing teeth that you haven't replaced them for so long, so you can always give us a call and come here at Soltani Periodontics and Implant Dentistry. We do a complete exam. We can give you all information you need in order to have a better, natural looking and more attractive smile.